Hello. I wanted to check in with everybody on my surgery. Today is day 6 of healing, and I wanted to talk about my pain, my bruising, my incisions, and kind of show what I could. I'm not going to make this very long, just a quick video, because I know my daughter will start pounding on the door in a minute, screaming at me. So, so what they did was they went in on my right hand and did surgery on did carpal tunnel surgery. So here is what my hand looks like. Day 6. You can see a lot of the bruising in there. There's 3 stitches. I've been trying to get the marker off, but it's really hard to do. And there's a little cut line. I have use of all my fingers just fine. 1, 2, 3, 5. I can touch my fingers together, except for this one's a little hard to do. That's one of the exercises they have me do. I also have to, go flat, and I have to do a fist, and I can feel that pulling right in my wrist area, which is fine. I can make my hand totally straight, which I can feel in the thumb area, like where my incision is, up to like right underneath where my tip of my thumb is, right in there. But I can move them and all that good jazz. And then they also went in on my right elbow, and I had a pinched nerve, so they went in to go fix the pinched nerve. Now, this one is the unpretty sight to look at. So I've got 1, 2, 3, about 6 or 7 stitches on this one. That's all bruising right in there. Bruising up in there. That bruising area is where I've got the most pain. It's very tender. Like if I were to rub it, it would still feel as though it's only the day after my surgery. Like I still have the numbing feeling to it, but and then the markings are from medical tape that I've been taping my gauze with, but the actual incision site doesn't really hurt at all. It's mostly the skin is so sensitive up around there, and the bruising is what really hurts. It goes all the way around there. Like I said, right up in there is my main pain. I can, stretch my arm out, and I can lay my arm flat and all that good jazz, but I want to say between the pain of my hand and my elbow, I think my elbow is the worst, especially because it's in a really sensitive spot. They want me to have my hand elevated, and that's very hard to do because where I have to rest my elbow is where my incision is. So that puts a lot of pressure on the elbow, and in turn gives me a lot of discomfort. But overall, it's not intolerable. It's more of an uncomfort, annoying situation. The hand, I can open stuff with my hand right now. I don't put too much pressure. Like I drove for the first time today since the surgery, and when I went to go put my car, from park to reverse, I couldn't grip that part. So that, of course, but I do a little cooking. I can kind of hold a spoon and silverware and right, and I can hold my toothbrush and stuff, but I try to do that all with my left hand until maybe about another 4 or 5 days. I don't want to put too much pressure on it, but they said that I'm healing the right way. My swelling, let me see, the day that we did physical therapy, my swelling was they measured my left arm, and then they measured my right arm, and the measurement difference was only like 1 inch to like 1.5 inches at most. So the swelling wasn't bad at all, very mild. And she said for the use, she had me do that with all my fingers and see how well I could do them and how much I can straighten them up. And she said everything looked really good. So positive outcome. It's only getting better. If you ever have to have the surgery done, it's not that big a deal. I'm gonna know, well, now I know what to expect if I ever have to have my left hand done, which that's a possibility, but it's not that bad. It's just annoying. It's hard for me to pull my pants up, pull my pants down, to, do certain things, but then again, I'm only at a week tomorrow, so I'm pretty pleased. So that's my update, and I get my stitches taken out on Monday, so I'm dreading that part. I don't want to feel these little itty bitty stitches coming out. Look at that. I'm not looking forward to that part. So hopefully he'll like give me a shot and numb me or something like that. But you know, that is it. Have a good day.